I asked the people who argue that we should repeal the ACA, who say all of this is so unnecessary, it's the government interference with healthcare. What part do you want to repeal? What about mandatory coverage for children under 19? Children under 19 with a pre-existing condition. Should we repeal that part of the law? How about first dollar coverage, insurance companies covering prevention and wellness so women don't have to shell out of pocket for mammograms?
As part of our work, we have an office in the Inglewood community of Chicago. We work at the Robeson High School. And why did we choose that high school? Well, actually it chose us. The principal called us because there was an article in the Tribune that said that 1 in 7 female students there was pregnant or parenting, which is something we don't want to see. So the Affordable Care Act puts $75 million a year through fiscal year 2014 in the form of personal responsibility education grants. And those grants are seeking to educate teens on both abstinence and comprehensive sex education so that we can seek to prevent and lower those rates of teen pregnancy. In addition, there's also $25 million for the next 10 years that will help pregnant and parenting teens through the pregnancy assistance funds. So that will help with costs such as health care, child care, housing, in particular for those moms that are trying to seek to complete their education. We want moms, if they do become pregnant or parenting, to complete high school.
We fought very hard for health care reform, and we'll fight even harder to protect it from attacks.
That's right.
There is no doubt that because of Affordable Care Act, seniors are better protected from private company insurance abuses and better served by Medicare. The Affordable Care Act is good for seniors here in Illinois and seniors across the country. There's been so much talk about the federal deficit lately. Everyone should know that the most important part of this new law is that it will extend the solvency of Medicare by 12 years. The Affordable Care Act also narrows and ultimately closes the unjust Medicare Part D donut hole. This year, victims of the Medicare Part D donut hole will receive 50% off brand name drugs and 7% off generics.